Hello and welcome to another edition of Health Matters. I'll be your host today. My name is Dr. Michael Chillemi. And in this episode, we are going to talk about spinal stenosis, the symptoms, the causes, diagnosis, and treatment. We're going to really get into a deep dive into this debilitating condition. This condition affects millions of people worldwide and can have a significant impact on the quality of life. We'll explore exactly what spinal stenosis is, how it develops, what the symptoms are, the anatomy behind it, who it affects, and some of the treatment options, from conservative care to surgical interventions. By the end of this, you will have a comprehensive understanding of this condition and some steps to manage and treat your condition and pain. So without further ado, let's dive right into it. So understanding spinal stenosis, we really got to start with the basics. What is spinal stenosis? Fun fact. No, not fun, but fact. The term stenosis actually comes from the Greek origins, meaning narrowing. So this narrowing is caused by structural changes. So it's pretty funny that the stenosis that we use now is exactly what that is. So stenosis refers to an abnormal narrowing of a passage in the body, such as a spinal canal. This narrowing can compress nearby structures, leading to a variety of clinical symptoms. The focus of this segment is going to be primarily the causes of spinal stenosis. So, in a question, how common is this? And how many people are affected? So, spinal stenosis is a common condition. I have patients every day in my office with spinal stenosis. It primarily affects people over 50. And the reason it does that, there is a big link between age-related degeneration of the spine and spinal stenosis. Studies estimate that 75% of people over 60 will have some degree of spinal narrowing, although not all will experience the symptoms of spinal stenosis, making this a very significant health concern. So let's get into the anatomy and how it's affected. So when we're talking about the anatomy, let's break it down to the spine comprises of 33 vertebrae, which are broken down into 3 different regions. It's actually 5 regions, but cervical, thoracic. So cervical is your neck, thoracic is your upper and mid back, your lumbar, which is your lower back, and then you have your sacral and coccosacral. So that's you're basically the lower part of your in between the pelvis, right? So that makes up the whole entire vertebral column. So your vertebrae are cushioned by intervertebral discs, which are supported by ligaments and muscles. The spinal cord is a crucial part of the nervous system that runs through the spinal canal. And the nerves' roots, they exit from the spinal cord between the vertebrae. Okay, so let's break that down a little bit more. So we're going to step into it a little bit. So the spine, as we said, is breaking up into the cervical, thoracic, lumbar, sacral, and coccygeal joint. Stenosis itself is most common, though, in the neck and lower back. Those are the 2 most common regions. In the cervical and lumbar spine are the 2 most common regions for it. The spinal canal, which is the hollow space running through the center of the vertebrae. So when you have your vertebrae right in the middle of the center of it, you would have your spinal canal. And the purpose of the spinal canal, it houses the spinal cord, which provides the protection and the space for nerve transmission. Narrowing of this canal can compress the spinal cord itself, and that is called central stenosis. Very common. Next piece of anatomy we're going to talk about is the neural foramina. So these are small openings on the sides of the vertebrae. When the purpose of these is so the nerve roots themselves can exit the spinal canal. And when you have these nerves exiting the spinal canal, what can happen is what's called foraminal stenosis, which causes the nerve root compression. Over time, you could have some degeneration and wear and tear, and other parts of the disc can degenerate, and you could have degenerative changes. And if you have anything that is involved with degeneration, you're going to have what's called spinal stenosis. So there's all different types of stenosis, and it is basically the narrowing of the space. So the process of constriction, narrowing of the space. In spinal stenosis, the spinal canal over intervertebral foramina is narrow due to thickening of ligaments, bone spurs, or displaced discs. You could have compressing effects causing to reduced space. So if your space is reduced and your nerves are going to be compressed, right? So basically, if you have a hole this big and you start compressing it, the nerves that are in the middle of it will actually be compressed, and that's what's going to be caused that spinal stenosis. So you can think of it as if you had a hose, right? So if you have a hose, and then in the inside of that hose, you have a certain amount of smooth surface, right? So now let's picture you put a bunch of junk into that hose, and now the space in the middle of it is less than it should be. It sticks to the wall. Let's say you put something in there and it's stuck to the walls of that hose. The amount of flow will be affected. So that's when you're going to have those compressions in there. So let's break down the primary causes of stenosis. So first thing we're going to talk about is degenerative changes with aging. So wear and tear, as people age, they naturally have degenerative changes, and this occurs in the spine, leading to the loss of structural integrity. What also happens is you have thickening of ligaments. So ligaments in the spine, such as your ligamentum flavum, can thicken and reduce the space in your spinal canal. Other degenerative changes are bone spurs, osteophytes. So osteophytes are bone spurs. Basically, as your bone grows, it can grow longer. So if you have a square bone and then you have something sticking off the edge of it, that'll be a bone spur. And that can form into osteoarthritis and protrude into the spinal canal, causing narrowing. What is some of the inflammation due to arthritis? So conditions such as osteoarthritis and rheumatoid arthritis can often cause chronic inflammation. So if everything's inflamed, the swelling in there will cause narrowing of the spaces around the spinal cord or nerve roots, and that'll cause compression. You could have synovial changes. So what's that? Synovial changes are the inflammatory process that can affect the synovial joints in the spine, further contributing to spinal stenosis. There is a next category I'll talk about is there a genetic condition towards this? So there is some certain genetic factors that can increase susceptibility to spinal stenosis, such as abnormal connective tissue structures, conditions like achondroplasia. There are several other ones out there, but there is a genetic link. Another way you can get spinal stenosis is with trauma, right? So injuries such as fractures, dislocations, or soft tissue damage can alter your spinal anatomy, leading to stenosis. Post-traumatic scar tissue. So let's say you had a car accident and you had a whiplash type injury. Over time, if that didn't heal properly, that scar tissue can thicken and therefore form with fibrous tissue. And when you have that thickening and changing of tissue, you can reduce the space within the spinal canal or the foramina. Other conditions that can cause spinal stenosis. Herniated disc. A herniated disc basically is a herniated or bulging disc when the inner material of the disc protrudes out and compresses the spinal cord or nerve. So you can think of it like a jelly donut, you squeeze it and it pops out. That's kind of what, what a herniated disc is. Tumors is another thing that can cause spinal stenosis. So benign or malignant tumors within the spinal canal can occupy space and cause mechanical compression, right? So anything that compresses or constricts that space is what's going to cause that stenosis. Vascular stenosis. So arteriosclerosis. So although we're really not talking about this for this type of focus, right? So I'm focusing in on more spinal stenosis, but vascular stenosis is basically when your blood vessels actually have that same type of deposits and you decrease the flow in there, and then you could have vascular stenosis. Congenital defects. So congenital spinal canal narrowing, certain individuals are born with abnormalities like small spinal canals, congenital lumbar stenosis, which make them prone to developing symptoms earlier in life. Okay, so how does someone say, how do I know if I even have spinal stenosis? So some of the typical symptoms that somebody would get would be pain, first thing, right? Pain, of course. So radiating neck pain or low back pain, or pain that going down from the neck into the hands or from the lower back into the legs. Lumbar stenosis can cause sciatica type pain, pain going down the leg. Numbness and tingling. Oftentimes you experience the tingling in your arms if it's coming, or hands if it's coming from your neck, and your legs or feet if it's coming from your lower back. Muscle weakness. So over time, as you have the spinal stenosis, as you keep constricting, you decrease the amount of flow, the areas weaken. And when they weaken, you could actually develop difficulty lifting your foot off the ground, gripping objects. It can change your muscle tone. In severe cases, you could actually have balance issues. So as your muscles are weakened, your ability to walk properly are significantly affected, and you can definitely have balance issues, which makes it difficult to walk. And when you have more progressive narrowing, it's usually referred to as neurogenic claudication, right? So where your nerves are affected, and pain is pretty significant with that type of condition. So if somebody asks me, how does spinal stenosis affect your life? So how would a patient affect their life with it? They basically would have everything we just talked about, right? So they would have chronic pain. They would have that numbness and weakness. They would have functional limitations. So obviously in the beginning, if you catch these conditions in the beginning, the symptoms are less. The longer and more it stays with you without being treated, the worse it gets. Right, so you could have functional limitations like the difficulty walking. And then all those different things can affect your emotional well-being, right? Living with chronic pain and can give you emotional changes and give you even feel anxious or depressed. So we definitely want to make sure we take care of those conditions. How does somebody diagnose spinal stenosis? So typically in my office, what I like to do is I really like to do a detailed history with patients, right? Really find out what's going on, how long it's been there, what started it, what are your symptoms, what makes it better, what makes it worse, and do a great physical exam, right? Really detailing everything that's going on with the patient, from the range of motion to the muscles, to the orthopedic test, to the neurological tests. And then also what we'll want to do is want to take x-rays, and x-rays will reveal potential bone spurs or misalignments. Typically, MRIs or CT scans will be one of your definitive diagnoses for stenosis. because they're going to look into the tissue more, and they're going to be able to see that better than an X-ray can. X-ray is going to show you space between bones, and MRIs are going to be able to show you the ligaments and tissues. So what are some of the conservative treatments for managing this condition? So typically in our office, we do chiropractic, obviously, keeping those spinal segments moving, keeping them functioning properly. We also like to incorporate physical therapy with that to focus on core stabilization, core strengthening to improve posture, increase spinal flexibility. We want to take the pressure off. Patients can take anti-inflammatory drugs like NSAIDs to help with the pain that they have. And this is listed as a conservative, but I'm not really sure. I guess I would put this as mildly conservative. You can get epidural steroid injections. So if it's severe pain, you could get those steroid injections to reduce pain and swelling. There is another problem with that, and I have a variety of problems with that, but sometimes you do need it. Those steroid shots will end up spiking arthritis usually a little bit more over time, but sometimes patients do need it for that immediate pain relief so they can actually have functionality, right? Other things you want to do is lifestyle modifications, low impact activities like swimming or walking, and you want to maintain a healthy weight to reduce stress. So non-conservative treatments would be surgical treatments, right? Surgery is when all other conservative treatment has failed and you have no other options. Then there are surgeries, whether you have a laminectomy, which is removal of part of the lamina of the vertebrae, spinal fusion, or usually spinal fusion is a little bit more advanced, and it's a little bit of a bigger surgery because it fuses multiple bones together, right? And then the other surgeries you're going to have is minimally invasive surgery, where they usually use small incisions for faster recovery. So there's a few different types of surgery that you can have with spinal stenosis. So how does somebody typically live with it, right? How do you manage those symptoms? So really managing stenosis involves balancing between physical activity and rest, stretching and low impact exercises like swimming or cycling that can help with increased mobility without straining the narrow region of the spine. Also want to keep your nutrition, right? You want to keep yourself well hydrated. I want to go over some of the people in the news lately that mentioned that they do have spinal stenosis and where they were and some of their information. So with that, the first one that comes to mind is Tiger Woods, who everybody knows is, one of the best golfers ever. He had undergone multiple back surgeries throughout his career to address issues from spinal stenosis and other back problems. In 2017, Tiger Woods underwent minimally invasive spinal fusion surgery at L5S1 after experiencing severe narrowing of the canal, which caused his sciatica and debilitating pain. Despite those challenges, after that surgery, he made a tremendous comeback and actually won the Masters in 2019, further showing and committing his legacy. But not only that, it shows you can overcome this condition and function. Another person I'm going to bring up is Peyton Manning, NFL superstar. Probably one of the top 5 quarterbacks, arguably top 10 of all time. He battled spinal injuries, disc herniations, chronic back pain during his career. He ended up going decompression surgery to relieve the pain, numbness, and mobility caused by these conditions. Peyton Manning resilience was evident by after he had some of those procedures, he continued to play, and he ended up winning the Super Bowl 50. And he was able to still function. I'm going to bring up 2 more people. Next person I'll bring up is Jennifer Grey. So Jennifer Grey was famous for her original role in Dirty Dancing back in the 80s. Kind of dating myself, but that's okay. So Jennifer Grey dealt with severe neck problems, and including spinal stenosis stemming from a car accident she had in the mid 1980s. She underwent multiple surgeries to correct those conditions, which threatened her ability to perform physical activities like dancing. Gray eventually regained her mobility and actually participated with Dancing with the Stars in 2010 and actually won it. Cheers. Last one I'll bring up is Sarah Michelle Gellar, who's an actress that was famous for her role in Buffy the Vampire Slayer. She had chronic back pain from several spinal injuries, and she's been outspoken about her undergoing treatment and managing her condition of pain and overcoming it. And it shows you that I just gave you 4 completely different types of people, right? So from golf to football to dancing to an actress, you can overcome it, right? So if they can do it and all those things, you can too. So let's bring it all together. So spinal stenosis by itself is a very complex condition, and it impacts millions of lives, affecting their pain, affecting neurological symptoms, affecting and restricting their daily activities. While aging is the most common cause, other factors, injuries, congenital anomalies, and systemic diseases can also contribute. Understanding the anatomy is important. Understanding how the spine works and how the narrowing impacts the structures that you have. It's important to understand that. So when your doctor is telling you what you have a clear understanding of what it is and what your options are. And there are many options, from conservative care to non-conservative care. There are plenty of patients and people living with spinal stenosis. And the key is to diagnose it early and to manage your symptoms. And if you do that, you'll have a better experience than most. If you do that, you'll have a better chance at functioning better. So in my office, I see this all the time, right? So this is, I'm practicing now 28 years. Pretty amazing. If you 28 years, I know, I see that number, I'm like, oh my God, 28 years. So 28 years, these hands have seen a lot, and we have treated a lot of patients with spinal stenosis. And so the question is, if you're doing chiropractic specifically, are you going to heal that spinal stenosis? No, you're not going to heal that spinal stenosis. You're going to try to correct the areas around it, right? So that's how we would manage it and treat it. But we like, in my office, we like to treat that with physical therapy. So you do that core stabilization, you do that strengthening. Usually that combination helps a lot of patients. But obviously there are patients that need further, right? You need surgery. When you need it, you need it. When conservative has failed, the next step is usually surgeries. So we always say, do everything you can, put everything against the wall that you can, try every conservative, because there's no going back from when you get cut, right? While surgeries have great success, it's still surgery, right? You can't put it back. You can't put the genie back in the bottle once she comes out. So the key factor is try everything you can, do everything you can. And there is hope, there is treatment, you can do it. We do it every day. As always, I would tell you, the information I gave you here is not deemed to be medical advice, medical treatment. Please seek a professional to diagnose yourself. Have them diagnose you so you can properly be diagnosed, so you can know how to function, right? You know how to help yourself. If you've enjoyed this, please, please, please subscribe, tell a friend. Don't be shy. I do tons and tons of different topics about different conditions, and hopefully I can try to give you a little bit of an insight on different conditions and what it actually is. Sometimes people don't understand these words that doctors say, and or they might have one thought of what it is and they really don't understand it. And whether they're too shy or embarrassed to ask or too afraid to ask, right? Some people don't want to know the true information about what it is and what they can do about it. But the more you know, the better you'll be. And be educated, right? That's the best way to be, is to be educated about what's going on with you. This way you could function better and you could have a better day, better life, better week, better month, right? That's what everybody's trying to do, is doing the best they can, function the best they can. And functioning the best they can is understanding. So, as always, what I say is you only get one shot at this. Take care of yourself, because at the end of the day, your health matters. I'm Dr. Chalemi. Till next time.